if you joined us. So hello and welcome to everyone who signed on. Thank you so much for joining us for this exclusive webinar briefing with Physicians for Human Rights. And we're going to focus this webinar looking at trauma of children who have been fleeing from Central America to the US to seek safe haven, and also more generally the crisis of the US-Mexico border, what we're concerned about, what we're advocating for, and how you can get involved. So my name is Kathryn Hampton. I'm the Senior Officer in the Asylum Program at Physicians for Human Rights, and I have the privilege of introducing one of our experts, Dr. Joseph Shin, who is a longtime PHR Asylum Network member, a professor at Weill Cornell School of Medicine, and an expert on asylum issues. As many of you know, Physicians for Human Rights has been providing forensic evaluations for asylum seekers for the past 30 years using the Istanbul Protocol, which is the international standard for documenting torture and other cruel, inhumane, degrading treatment, with volunteer clinicians assessing the degree of consistency between physical and psychological after effects of torture and persecution, and producing findings which can be very relevant in adjudication of asylum claims and other types of legal relief which are available for people coming to the US. So Dr. Shin has been volunteering with PHR for more than 10 years. He has conducted countless evaluations of asylum seekers. He has trained hundreds of clinicians, and he has mentored students at Weill Cornell Center for Human Rights, where he is the medical co-director. So welcome, Joe. Thank you for joining us. Could you take a moment to introduce yourself, your background, how you came to do this work?
Sure. Well, first of all, Kathryn, thank you, and PHR for having me here. It's really been a long journey, and it's started probably over about 15 years ago when I was a medical student. And just like I have the privilege of being able to mentor and teach students right now, when I was a student at NYU, I had the opportunity to work with a really esteemed mentor, Dr. Alan Keller. Many in the audience sort of doing in today may be familiar with his work, and also his founding of the NYU Bellevue's program for survivors of torture. And at the time, I was very interested in understanding more, not just about the medical conditions that many patients, as I was learning about them, were experiencing, but what were the social determinants, what were the political, what were the other sort of factors that contributed to their poor health or their trauma. And at the center, which was designed not only to evaluate individuals who are seeking asylum, but also to be able to identify and provide long-term care for them, I was really able to understand what terrible sort of experiences these individuals and families have gone through, and also how a coordinated effort, not just with mental health professionals or medical doctors, but also social workers and also legal experts can really, what they can achieve working together to be able to help these really traumatized and vulnerable individuals. So it was through that work, understanding this very comprehensive model, also understanding the expertise and the unique tools that lawyers and human rights advocates have, when paired with the expertise and skills that physicians have, how powerful that kind of collaboration can be. And so over those years as a student, involved in conducting individual evaluations, also later as a resident and attending at Bellevue, actually taking care of many of these patients as a primary care doctor. And in more recent years, especially after I moved up to Cornell, really taking a step back to understand how we as a community of physicians, human rights, and also legal advocates can really work together to advance our effectiveness in advocacy, and how that can be augmented by really meaningful and impactful research. So I think that we do have the privilege of being able to enter into the lives of many of these individuals seeking asylum, all sorts of violence and persecution. And then that's powerful for those individuals, but collectively we have a broader insight into some of the larger human rights we just happened to see it most acutely at the southwest border in the last few years. So, in short, that's kind of how I think my journey has changed and evolved, both personally and professionally. And it's all been done with the help of important mentors, but also organizations and institutions. I think we've been able to work at two academic medical centers, NYU, and also Cornell, that are supportive of this mission, but also working with work partners like PHR and other human rights organizations, and also increasingly legal professionals, both practitioners at NGOs, maybe in the pro bono practices of law firms, and also many law schools now too. And I think we have the ability now to really think about how we can collectively build capacity in all of these realms to help these groups who are seeking asylum.
Thank you for that introduction. And I think it's really interesting that a lot of the themes you mentioned, which are relevant in your own personal life and work, really parallel a lot of the themes that we see in terms of the growth of the PHR Asylum program in recent years. You're coming as the co-medical director of a clinic, and that's a partnership that has been so critical for PHR to develop this asylum work. And we've noticed an expansion of medical school clinics going from 6 clinics in June of 2017 to 20 clinics in June of 2019. So we've seen a really explosive growth in the interest of students and faculty to undertake this work, to partner with PHR. And then these clinics have been really critical for training the next generation of clinicians. Since in 2018 alone, actually 1,100 medical professionals were trained at a combination of either PHR trainings or clinic trainings. And we've gone from around 800 medical professionals a couple of years ago now to 1,500 medical professionals. Another theme that you mentioned is, how important it is to connect this kind of services provision with sort of the big picture. And you could see it from an epidemiological perspective if you're talking about treatment, or if you're talking about human rights. It's about advocacy, it's about accountability, it's about policy change. And that's something that we've really been excited to partner with clinics, especially in the last couple of years, looking at, and a lot of clinics are doing this independently as well, looking at how can the case record generate research which can really speak into the policies that we're implementing that are affecting these very populations, and bringing those medical voices to Washington, to global capitals like Geneva, really seeking to reach decision makers at different levels and different institutions with this kind of direct experience that you bring with patients, and also the medical expertise, medical and mental health expertise. So I'd like to ask you about your experience going to Geneva. Dr. Shin and I went to Geneva together to present his research, the research of his team about trauma of children fleeing violence in Central America, and we could discuss those findings as well. But it was very moving for me to see Dr. Shin speaking at the plenary session of the Human Rights Council, addressing the High Commissioner on Human Rights, who is herself a pediatrician, and bringing to the global stage, really addressing states and saying that what the United States does to asylum seekers and migrants who are arriving at the southern border, it's not just some kind of internal matter that can be ignored, like it's actually a global issue, it's a regional issue. And just emphasizing that this takes global and regional solutions. So I'd love to hear how your experience was going to Geneva.
I think, first of all, it was an amazingly powerful experience for me, and it was a privilege to be able to represent not just the results of this research that we've been doing with PHR, but really I felt like I was representing this whole network of clinicians, physicians, psychiatrists, students that contribute to the work. I'll talk about Geneva a little bit more in a second, but just to make a comment about I think the really rapid growth that you had pointed out, even just these last few years. When I started doing this work, as I mentioned, it was within a academic center like NYU with a well-established program with mentors. And I think I had an initial assumption that everyone was doing this work with partners as part of a larger community movement, which there was. And I recognized that this really builds upon decades and decades of work. But as I began to do more work in outreach, doing more trainings at NYU and then eventually Cornell, and especially in these last few years when, with the current political climate, more clinicians who maybe aren't affiliated with an academic medical center, social workers, lawyers, even without the community, really wanted to respond. They were kind of coming out of the woodwork. In January 2017, I think the week after the inauguration, we had basically like a standing room only crowd at our training. And we actually had to cap registration because like, safety and fire code issues. But during that time, I got to meet a lot of individuals that were seeking out to do this type of work, but were coming maybe from a private practice, maybe weren't engaged in a larger community. And they really wanted not only to do this work, but also connect, not just for that sense of community and belonging, but also to be able to rely on others who had maybe more experience doing this work. They could rely on other clinicians if ethical or clinical question arose. And that's when I saw that, yes, there's a long tradition and history of work that's being done by this community, but there's so many people that are wanting to get involved. I think PHR's ability to work with medical centers, but also reach out to physicians and practitioners all across the country to contribute this work has been really key. And kind of, shifting gears a little bit to what we did in Geneva, all of that work was basically based on a compilation of data from years and years of forensic medical evaluations that had been done through the Asylum Network program. They weren't all done by me. They weren't done at Cornell. Really, it was a national network that was able to do thousands and thousands of evaluations. And we were able to focus on a period of time from 2014 to 2018 and pull out several hundred child and adolescent evaluations, which was basically the basis of this report. And it was only through that kind of collective action over years and years that, with enough data, and I think at the right time when we're beginning to pay attention to issues, that we could conduct rigorous analysis of that data and really present that to decision makers and really put it in the hands of advocates, both here in the US and also internationally, to really shine a spotlight on what was going on. And for anyone who has already taken care of someone who's been a victim of torture or human rights abuses, we can understand through their experiences what happens in the shadows, or what happens when people in power can deny what's going on, when people who are committing these atrocities can just blanket them over in a shroud of darkness. And here we're seeing actual evidence in which we can shine a light on the experiences of these children, many of whom suffered tremendous trauma in their home countries, tremendous trauma in transit, and many of whom continue to experience trauma even in the US as a result of contact with US Border Patrol, Immigration Customs Enforcement, detention, family separation, inadequate housing, facilities, shelter, and certainly inadequate kind of responses to any of their medical and mental health. So that's sort of, I think, the lead up to Geneva. And being in that setting, I think it was both encouraging, but also sobering. If you can kind of understand what that experience is like. On the one hand, to be able to speak on behalf of these children who've experienced this trauma, and also on behalf of the doctors and clinicians that worked to conduct these very careful and sensitive evaluations, and share just how much trauma was occurring. That we have data to really push back against some of the other alternative narratives about who these children are, that they're taking advantage of the system, they're crossing illegally, that they're being trafficked, that they're not representing who they are. When here we actually actually have a lot of clear and compelling data that they've experienced all sorts of trauma, gang violence, domestic violence, labor, sexual exploitation, abuse, all sorts of things. And I think being able to quantify and characterize and really shine a light on their experiences using really rigorous methods, I think that's powerful. And that's one important tool in trying to advocate for change. And I hope that, and some of the feedback that we actually got in Geneva, I think, was encouraging to know that people who have access to the decision-making circles internationally, regionally, and domestically, that this data was useful for them, that it could help them in their role as advocates, in their role trying to shape policy and pressure those in power to make the right decision. That was encouraging, but by no means, I think, did any of us come away thinking that everything was solved from a single report like this, but it does contribute.
Absolutely. Could you share a few of the highlights in terms of the findings from this research that you did?
So in this sample of a little over 180 children and adolescents, it's no surprise that the vast majority of them are coming from Central America, from what's described as the Northern Triangle countries. About 90% of these children came from Honduras, Guatemala, and El Salvador. And again, unlike some of the other narratives that have been introduced in the public dialogue, we see that almost 80% of these children have suffered direct physical violence. A similar proportion suffered indirect or threats of violence, for example, friend violence and coercion into gangs. So, for instance, recruiting many of these boys and young teenagers into gangs on threat of violence against themselves or maybe family members or friends. Many of them witnessed severe acts of violence, including the murder of people of their loved ones, the mutilated bodies of family members found later on by the police. Many of them witnessed aggravated assault and even rape and sexual assault as well. And these are children. I think a couple of things that really stood out as well was just the degree of sexual violence, especially reported by the girls and young women that we saw, but also a significant portion of the boys as well. And there is some concern that maybe some of that is even underreported. But these children, many of them suffer significant trauma, and oftentimes it's multidimensional and prolonged. It's not we found that it's not usually a singular event, but oftentimes a series of events that might unfold over weeks or months or even years, in which they are subject to physical violence and beatings, repeated sexual abuse and assault from family members, people in the community, gang members, and it's all done with impunity. Many of these children or family members report that they attempted to get help from the community or police or other authorities, but that they were met with ineffective responses, sometimes sort of more direct responses, like corrupt practices, including bribery or intimidation. And so many of them are left with really no other recourse than to leave these situations in which they fear for their lives. I think something else that often doesn't get discussed enough is that, yes, these are children, they suffered trauma, but sometimes it's sort of dismissed as like, oh, they're unfortunate children, that's too bad. But something else that we saw in our research was that many of them suffered from diagnosable and quite severe symptoms, severe depression, anxiety, PTSD. And I think one of the most compelling kind of results of the study showed very high rates of suicidality, again, in the child and adolescent population. And even though there is data suggesting that children and adolescents may have suicidal thoughts in passing and maybe take steps towards self-harm, when you take that level of suicidality and pair it with many of the diagnoses these children have, and oftentimes it's not one, but multiple diagnoses, depression, anxiety, and PTSD, for example, the threat of real lasting harm and even death at their own hands or harm at their own hands seeing examples of that in which these children who suffered physical harm and psychological harm are at an increase of really acute mental health emergencies. We've seen having this attention in other facilities will be run by ICE or ORR. We've seen this even in the community, where maybe children are separated from their parents, and even if a child is released, having that prolonged separation from a parent who's either in detention or maybe been deported back to their country of origin, that leads to high risks of psychological decompensation too. And so, again, it's not just that these children are unfortunate, they've experienced bad things in their lives and they need to get over it, but they really come with serious and severe mental health problems. And I think as clinicians, our first step is being the patients where they are, understanding what they've been through, what they've experienced, and using our expertise to come up with diagnoses. But the next step is to try to treat these individuals. And from the standpoint of this human rights work, sometimes we are in a position where we can treat them, or at least refer them to treatment. But in many times, we really need to be advocates so that they can access treatment in whatever system is taking care of them. Whether it may be in OR custody, whether it's after they're released to family or released to the community. And I think that's sort of the next natural step for for myself and many of the clinicians that I work with, that we want to not just document what's going on, but really try to advocate for solutions. And like many experts have testified, over these last couple of years, we don't really need to reinvent the wheel. There's a large body of research that understands what the needs of these children are, how to assess for these needs, and what it really takes to provide safety and healing. So there are standards out there, but unfortunately, very few of them are being met, and some of them are being ignored with the community. And I think that's where me and my colleagues here at PHR and in this larger network really taken up that call to advocate for change at the local level. Even earlier this week, PHR experts were testifying in Washington, D.C. about some conditions that were completely inexcusable and sort of what the unfolding humanitarian crisis of the southwest border is resulting in terms of increased risk of violence, medical complications, mental health decompensation, and this sort. So it's really inspiring to see colleagues really take up the call and speak out.
Well, you're also very inspiring. You inspired me a lot also when we went to Washington, D.C. together. And that was something that was had a lot of very positive response from the congressional offices that we met with, where you would emphasize, okay, we have these extremely sobering findings about the high levels of trauma among children, and even highlighting, for example, so the study found that about 3/4 of the children had a major mental health diagnosis, and you're pointing out that among combat veterans from Iraq and Afghanistan that you worked with in the past, you would actually expect to see more like a 10 to 20% rate of major diagnosis as a result of trauma. But at the same time, you would emphasize the children's resilience. And just as you said about not reinventing the wheel, actually we know how to help these kids. The medical community has so many standards and best practices, and I think that's the most heartbreaking, I think that's one of the most heartbreaking things about seeing these government policies that have resulted in deaths of children and extensive traumatization of children and families and adults, is that we know how to do better, and so we have to do better. And I think that's why it's so your research is so critical, and just your voice emphasizing that we know how to do better. And I'll just highlight two bills that PHR endorsed and advised on. One was Senator Heinrich's office, the Remote Act, which offered incentives for Border Patrol agents to train to be paramedics and EMTs to hopefully have a bit more medical capacity at the border for urgent cases. And then Representative Ruiz's bill, the Humanitarian Standards Bill, and Dr. Ruiz is also a medical doctor, and so drawing on feedback from medical professionals, including PHR experts, seeing how the best practices and standards from the medical community can really be mainstreamed into our policy responses. And so I felt like we had a lot of positive responses from congressional offices when we went with you and other clinicians who are interested in knowing, how can we integrate these trauma-informed best practices. Another thing which is interesting for me related to your findings was that actually the Department of Health and Human Services Office of the Inspector General issued a report about children who have been separated from their parents, and one of their main findings was just about the trauma of children. It was pointing out that, you can't just, as you were saying, you can't just say, the kids just need to tough it out, they need to get over it. They were talking about children who are crying uncontrollably, children who are self-harming, children who couldn't eat, and how keeping them in government custody away from their parents was creating this impossible problem and situation because the institution simply couldn't handle that kind of challenging response. So I think that emphasizes how critical it is that, if someone is coming with trauma, let's treat them using the standards and best practices and, make a pathway toward recovery and healing and not exacerbate those traumas.
I think you point out a lot of different ways in which PHR and other physician advocates have played a role here. And I think that one of the takeaways that I took in working in Geneva, working in DC, working on some of these other advocacy efforts is that there are so many areas in which we need to bring accountability. There's so many areas for potential improvement. It's sometimes overwhelming. But we sometimes, I think about what our priorities are, what our sort of strategy, what our tactics are. And I think there's a lot of room there for people to work on different aspects of this, whether it's bringing accountability with the immigration detention system and some of the lax standards, lax enforcement, lack of transparency that's there, whether it's trying to provide even the minimal standards of training, like EMT training for some border officers, to provide some minimal sort of safety net should they come across a family who is dehydrated or has suffered some acute infectious illness and needs some sort of first aid to be triaged appropriately. But that said, even though those efforts help move the needle a little bit, I take this kind of lesson from, I think, folks that have worked in similar types of advocacy in the correctional health space. You can work towards improvements to provide maybe relief for some of the most immediate. And you can also work to help dismantle systems that intrinsically put people at risk of greater harm. And you can do those kind of simultaneously. And again, I think there's room for different strategies and different tactics, and there's so many ways in which different people can navigate. I think it's important to kind of, to use a sort of a sports reference, to kind of have that full court press. Everywhere we can kind of direct resources to bring accountability, improve care, improve emergency response, improve training, I think is moving in the right direction. And I think there's room for all of these efforts. And I think also to be able to work with legislators who have a variety of backgrounds, like working with Representative / Dr. Ruiz's office, I think was also really powerful because he, among many others in Congress, also have healthcare background. And I think they also share similar kind of credibility and expertise from their experiences that many physicians in PHR do. And my hope is that they can also lend that kind of weight when they're debating, when they're introducing measures on the floors of Congress and trying to seek out accountability. So yeah, there's so much work to be done.
I love what you said about the full court press, and I love this idea that different players are going to have a different contribution to the game and to moving the team forward. And even just the research that you've done reminds me, because we have more than 100 clinicians who actually provided individual evaluations for each child's case. So it was used toward their asylum case, and then again used in research for advocacy. So I think this idea of engagement at so many different levels, with each person playing a unique role, is very relevant for our constituencies here at Physicians for Human Rights, and also how PHR fits into the wider human rights movement. So we have, we have our own unique and special role to play, and then all of our members and people who are affiliated with us also have, varying roles. I'd like to shift gears a little bit to talk about the wider context. So this is something you've mentioned, but we've seen massive changes in immigration and asylum policy in the administration. Most recently this week, the new asylum cooperative agreements that are sending people back to, non-Guatemalans to Guatemala to seek asylum there, even though there's, Guatemala is not able to provide safety or an equitable asylum process that would grant them any access to protection. And another policy that we've seen throughout this year has been the migrant protection protocols, or the Remain in Mexico policy. And earlier this year, I was with Physicians for Human Rights, doctors and researchers in Tijuana, visiting a camp in a stadium which had horrible conditions, no drainage, no sanitation, just no coverage, like just puddles and trash, and completely unsanitary environment, and also visiting migrant shelters with also quite inadequate conditions, and where people are afraid to leave the shelter. They're afraid because multiple people that we spoke to had already been, followed by gangs or cartels. They'd been beaten. They were terrified of being, harmed by their persecutors. They did not feel safe in Mexico. And as you mentioned, Dr. Todd Schneeberg was just testifying this week before the House Committee on Homeland Security, based on his extensive work in Tijuana, and just describing many of the scenarios where people really have a strong claim, at least to be considered for asylum, based on the harm they're fleeing, severe harm that they're fleeing. So could you tell me a bit about how you see this as, a doctor? You've been to many detention centers. How do you see these new policies? What are your concerns as a clinician with these kind of policies that are, this asylum-seeking population that you've interacted with so much in the U.S. that are even forcing them to Mexico or to other countries?
Talk about a real absence of leadership, a real surrendering. I think a lot of core humanitarian values that have been ingrained not only in U.S. but also international law, practices and policies. There's a lot of discussion that's been going on these last several years about what our nation's response should be towards just immigration in general. There are a lot of sympathetic subgroups, whether they're fleeing natural disasters, whether they're part of DACA. Many of the children that we evaluate as part of this program, they obviously experience trauma, but so much of the discourse basically seems to ignore all of that. And issues of, quote-unquote, border security, national sovereignty, and sort of maintaining national security, that seems to have, I was going to say trumped, but that seems to have really just, in many people's minds, like taken over the entire discussion about what to do about these migrants, about these asylum seekers, about these people with violence. And so, I see the role of many individuals associated with PHR, other doctors, human rights advocates, to be able to just, get everyone to focus on what really matters here. Yes, border security, due process, all of these things matter. But at the core of it, we're dealing with people, we're dealing with children, we're dealing with families, by and large. And we really need to have a very trauma-informed stance, not only when it comes to their individual care or their evaluation, but I think that, physicians, clinicians can really help advocate for what it means to have a trauma-informed stance when we're thinking about making policy, when we're thinking about how best to run kind of many of these border patrol and immigration agencies. Because what we're doing is, in the short run, while some may applaud these efforts at really securing the border or really sort of getting rid of basically these people who are legally trying to file for asylum, it really ignores what their needs are. It really ignores the real trauma they've experienced, and then we can just help to refocus what really matters here. again, documenting for individuals, for the individual asylum claims, what they've gone through and consequences that it's had for them. And also to be able to, in aggregate, try to use a lot of this data, this understanding, this expertise to kind of inform better practices. Because in the long run, what we see here is a humanitarian crisis that is not going to be solved by what's being offered now, and will likely continue to grow in severity and scale and in some ways durability. We are seeing an entire generation of people who are suffering trauma because of poorly thought out policies from the generation before. And it does make me fearful looking into the future about what's going to happen to these many, not just tens of thousands, we're talking about hundreds of thousands, soon to be millions of people that are fleeing. And we need to think about more long-term solutions that are trauma-informed, that take into account the humanitarian medical needs that they have, in addition to the many other concerns related to security, related to due process, to sort of the immigration legal system, and really reform things across the board. I think that, again, I think that physicians have a unique and powerful voice here to really be able to help people focus, help the public, help our leaders focus really on what matters.
Yeah, so the Asylum Network will continue to provide individual evaluations, and we have a few more research projects kind of building on what we started with you guys at Weill Cornell. One will be looking at specifically domestic violence and gang violence survivors. As you know, the previous and current Attorney General have undermined protections for those client groups because they've said that domestic and gang violence survivors face a higher threshold to prove that they're part of a particular social group and can meet the requirement of having a nexus with a protected ground to achieve their asylum claim, and also that people who are part of a family unit also have a higher, required a higher standard of proof to show that they're being persecuted because of their membership in a family, which describes actually a large proportion of our clients. So that's something we're looking at more in depth with UCLA. And we're also doing a study with the University of Michigan looking at the psychological effects of family separation. A small group of clients who experienced family separation under zero tolerance. What the clinicians documented in those cases was really the severe trauma that we expected to see from this client group. And then also we have a study with CUNY looking at case outcomes, and so how impactful, what is the impact actually of these forensic evaluations on individual cases. So that's something that we'll be looking into. But can you tell us what 2020 looks like for you and Weill Cornell?
Well, 2020 is a really exciting year because it actually marks the 10th anniversary of WCCHR. And, not that we were the first program that worked in this kind of medical legal partnership, but it's certainly the first student-run, faculty-supported program that was founded in such close partnership with PHR. And as we commented upon earlier, it is a model that's growing very, very quickly, expanding. I think because of the interests among medical students, but also at faculty in many of these institutions to try to support these efforts. Med student advocacy has a long history of real passion and also effective responses. You have back to the civil rights movement, advocacy around HIV/AIDS, students, academic medical centers play a really big role. And I think that the role in this arena around health and human rights, we're seeing, I think, a new phase in the maturity of that community and the efforts there. Much of the work, at least speaking on WCCHR's kind of perspective and experience, much of the work early on was really in building local capacity at our institution, training students, training our clinicians, and conducting real individual evaluations and advocacy. But over the years, that's grown to not only continue to build that capacity here at Cornell, but also to be able to provide technical assistance to start programs at other academic centers based on this model, to kind of complement many other programs that exist as well, including the programs of torture, terra firma, and many others. And I think by expanding this capacity at academic medical centers, we have an opportunity to bring in some other public health work around policy analysis and advocacy, and really be able to build capacity in those areas as well. It's just like as we've talked about, it's sort of natural that individual care, individual advocacy, medical legal partnerships collectively grows into research with greater power to influence policy. And I think other partnerships that can kind of grow and mature along those lines are also greater partnerships, not just with individual law firms or individual human rights organizations, but maybe also with universities, with their law schools and schools of policy, to be able to work on some of these issues together. This past year, we were able to launch a pilot program between Weill Cornell Medicine and Cornell Law School in Ithaca. Even though we're 5-hour commute apart, it's really allowed us to come together to really think more critically about ways in which we can be conducting this type of work more rigorously, ways in which we can train young lawyers and doctors to work more collaboratively, and also to contribute to meaningful research and advocacy like we've talked about occurring this past year. So I think 2020 marks, at least for WCCHR, a point in which there's this next level of maturity in which we can kind of begin to reach out and really think about ways of establishing better standards of practice, establishing networks in which, as our networks grow, each program isn't left to their own kind of design things from scratch, but where we can really think about applying some of our own skills, maybe in quality improvement, quality assurance and assessment, to really think about how we're running our programs, how we're measuring effectiveness, how's our capacity, can we handle the number of mental health evaluations or medical evaluations or GYN evaluations that are coming through, can we streamline operations so that data is more secure, so that we can conduct research more efficiently, so that we can share these practices and other clinics. I think those are some of the questions that we're really excited to launch into. We actually have a sort of 10th anniversary conference coming up April 24th and 25th, in which we'll kind of look back at what WCCHR has been doing with PHR these last 10 years, but also take a step and look forward. We invite many other students and also faculty in all the other programs, and also researchers as well, whether you're affiliated with one of these groups or not, to come join us in thinking about how we map out the next 10 years of growth. Again, building capacity, achieving a certain degree of clinical excellence, being able to share best practices and map out what a research agenda looks like to help support a lot of these efforts. And the need for this is not going away. Many people, I think, look to, at least in the United States, look to the 2020 elections and the election afterwards to sort of see maybe a curtailing of some of these policies that we've talked about today. But even if all of that gets turned around, again, the systems, the types of systemic violence that these people are facing, and also the sequela, like what are we doing with these tens or hundreds of thousands of asylum seekers when they're here? We're able to establish, residency and legal status. We're going to need to work as a community to understand how to best evaluate their needs, treat them in a comprehensive way, in a multidisciplinary fashion amongst clinicians, but also working closely with lawyers as well. Because their medical problems are their legal problems, and vice versa. So I think these are some of the really exciting but the challenging things that are in line for us in 2020.
Well, congratulations on the 10-year anniversary. That's a really great milestone, and I think it's so great that you're taking the time to really reflect on the achievements of Weill Cornell Center for Human Rights, which has been, such a model for clinics around the country, and such an amazing, offered such amazing services provision as well for so many clients in the New York area, and that you're thinking strategically about where the program can go from there based on these great achievements. So it's very exciting, and we'll look forward to hearing more about that. And I'd like to tell you about one last project with Physicians for Human Rights that will be launching next year, and of course we'll be inviting WCCHR to join us. A detention monitoring project. Although asylum seekers are being sent back to Mexico and other countries, there are still more than 50,000 immigrants detained in U.S. detention centers every day. The number has been increasing, the duration of detention has been increasing, and as you know, because you're a long-time advocate so much research and work in detention centers in the U.S. But the conditions of confinement are terrible, and we really want to mobilize the network and the network clinics to visit detention centers in their local community, to document what they see there, and then to combine our efforts to really be able to say something about the systemic change we want to see, as well as advocate at the grassroots level. So that's something we'll really be working with you on to build this different program.
I think that's just another example in which working with PHR, working with lawyers, not only to kind of use my tools as a clinician and a researcher to document what's going on, but also play a role in what that local strategy looks like to advocate for change at that level. Trying to organize community organizations, human rights organizations, work with lawyers, maybe potentially on strategic litigation involving individuals or whole classes. I think that's also something on the horizon too. And detention centers just happen to be one area in which all of these forces are kind of colliding, and in which we're seeing, unfortunately, some of the most egregious violations of human rights and basic standards of care, and where I think there is just so much mobilization of resources and money to try to continue to build out that system that we really need to respond.
I visited a detention center about 2 hours outside of El Paso last year, and with two of our medical experts, and what we found were inadequate food, inadequate clothing, poor conditions, lack of access to medical care. Detainees that we met with actually said that they were afraid to talk to us about conditions. Very insufficient mental health care, inappropriate use of segregation. And so I think there'll really be a lot of critical issues where the voices of detainees and asylum seekers will really be at the heart of the change that we're seeking. And I think that's something that I really come away with, having talked with you. This research was really based on the stories and the voices and the narratives of the children, what they found to be important, what they said to PHR's clinicians. And so I think that will really be a guiding light for us moving forward, is listening to affected communities, listening to people who are affected by these policies, and then also matching up that medical and legal expertise to really leverage solutions. So that's it from us. Thank you for joining Physicians for Human Rights exclusive briefing on trauma of children fleeing violence in Central America and the crisis at the U.S.-Mexico border. So we hope you found this talk informative. We hope that you continue to join us for webinars in upcoming months as my colleagues sit down to brief you on critical aspects of our program work. And so at the end of listening to all of this, you might be wondering what you can do. And I'd like to propose 4 simple ways that you can get more involved. If you are a health or mental health professional, please consider joining us as a member of the Asylum Network. You can find information on our website about how to join, how to attend a training. You can also join PHR in advocating against human rights violations by taking action. We have a page of action alerts on our website where you can personally send feedback to the Department of Homeland Security, to your members of Congress, and you can really, speak into a lot of these pressing policy issues, and those action alerts are updated on a regular basis, so your voice can be heard. We also invite you to join our community on social media, since this is a great way to connect with other human rights advocates. We have Dr. Shin on our Twitter. You can follow him as well. He has some great tweets, and you can keep up to date with developments, new action alerts, policy updates, and new research. And finally, we'd encourage you to donate. PHR has been supporting asylum seekers in the U.S. for more than 30 years, and we couldn't do it without your help. And Giving Tuesday is just around the corner, so actually your donation would be tripled by a generous group of your fellow advocates, and will help us keep filling critical. So we'll circulate a recording of this discussion in case you want to watch it later or share it with others, and thank you so much for joining.